Welcome to the Brilliant Board Review Podcast, your trusted source for high-yield board prep, CME, and the latest in clinical medicine.
Let's talk about cardiac myosin inhibitors. Now, this drug, Mavacamten, it's used for HOCM. Remember, that's a common heritable cardiac disorder by left ventricle hypertrophy due to mutations in genes such as the cardiac sarcomeres in the myosin binding protein C and beta myosin heavy chain. Mavacamten targets the underlying myofibrillar disarray, an abnormal mitral apparatus that contributes to left ventricle outflow tract obstruction. Remember, the blood doesn't come out. The blood comes in but doesn't come out. They can't get out. Now, it's indicated for patients with New York Heart Association Class II and III secondary to obstructive HOCM. It's to improve functional capacity and symptoms. It's a select and reversible inhibitor of cardiac myosin ATPase. Now, the EXPLORER trial 2022 showed that after 62 weeks of therapy, Mavacamten was associated with decreased resting and post-exercise left ventricle outlet flow obstruction, tract obstruction, and it improved New York Heart Association cardiac failures symptoms, classification, enhance exercise performance. And I know in the past that we're told, and people at HOCM, they shouldn't exercise. Well, they should still exercise, maybe not to the level that they were if they were an extreme athlete, but slowly bringing their exercise capacity up under supervision, of course. Now, in order to start this medication, the left ventricle ejection fraction needs to be greater than 55%. You need to avoid negative inotropic medications. Well, it makes sense because the adverse effects is it reduces systolic contraction. In most studies, it's going to show about 10% reduction. So you have to follow up with constant echoes, and there's actually a schedule. These patients need to be following up with constant echoes. You can have worsening heart failure, makes sense because your ejection fraction is going, or you can have complete block of the ventricle function. So these are things to think about. This is a change. Now, remember, before in the past, patients with HOCM, we said, hey, you shouldn't exercise. Now they're saying they should exercise to avoid metabolic dysfunction. And they're going to have to do it slowly under controlled circumstances. Now, if they have to, and this doesn't work, and they have to get surgery, surgery is recommended in centers where they do large amounts of these surgeries, okay, for obstructive left ventricle outflow tract obstruction.
Thanks for listening. Visit brilliantcourses.com to learn more and claim credits for this educational activity. See you next time.